friends, this is Ruchi Chadda, Physiotherapist, Midas, a complete wellness and aesthetic center. Today I am going to be discussing a very common overuse syndrome of the elbow, which is tennis elbow. Normally, this condition is seen when people are using repetitively their hand in a particular position. You could be working on your computer, or you could be reading a newspaper, or you could be using some broad heavy knife in the kitchen, some kind of a hammer or a plumbing tool. Could be something related with long hours of gardening or painting or lifting heavy weights, and that could have led some stress on the elbow. Tennis elbow is seen in the extensor muscles of the forearm, and they originate from the lateral epicondyle of the humerus. Now, somewhere or the other, the muscles have counteracted some kind of a micro tear, some calcification, some vascular reaction that has all, conglomerated, led to some kind of a swelling or pain. It is commonly seen equally in both sexes, and generally people between 30 to 50 years of age seem to be more reporting this incidence of tennis elbow than individuals in other age groups. Of course, other age groups could also be affected. So, I'm going to be discussing about the diagnostic tests for tennis elbow. The first test I'm going to discuss is the Cozen test. This test is going to provoke extensor carpi radialis brevis and longus. If the test is positive, there is going to be pain at the outer end of the distal humerus. The patient is comfortable, sitting or standing. With one hand, the therapist fixates the distal end of the humerus. With the other hand, the therapist pronates the patient's forearm. The patient's elbow is bent and the patient has made a fist. The therapist now resists patient's wrist extension. If this movement evokes some kind of a pain on the lateral epicondyle of the humerus, this proves that the patient could be suffering from tennis elbow. The other test that I'm going to discuss now is the Mills test. Patient position is comfortable, sitting or standing. With one hand, the therapist is again fixating the distal end of the humerus of the patient of the affected arm. The other end pronates the patient's forearm and also flexes the patient's wrist and extends the elbow. If this movement provokes a sharp pain around the distal end of the humerus on the outer end, that is the lateral epicondyle of the humerus of the patient, this proves the patient could be suffering from tennis elbow. Our role is definitely going to be to relieve pain and also to reduce swelling in the first instant. There are certain activities of daily living which actually cannot be avoided, and we just can't say that rest is an option. What as a physiotherapist I would suggest would be activity modification. First of all, let us reduce the number of hours that we are in a particular position, like working on a computer or reading newspaper, and let's go for a few stretches in between. Also, while we are doing certain kind of activities like cooking or ironing, we could use alternate hand and not the same hand which is affected for work. The patient initial stages would also be suggested icing 6 to 7 minutes 3 times a day. The physiotherapist would also apply certain modalities like ultrasound or TENS to help reduce swelling, inflammation and pain at that point. There are a certain group of exercises that now I am going to demonstrate, which the patient is going to perform. Stretches with wrist flexion, stretches with wrist extension, concentric wrist extension, eccentric wrist extension, elbow flexion, elbow extension, pronation, supination, myofascial release. As you can see, I am doing rhythmic, slow, circular, unidirectional movements. Hope this information is beneficial for you. If you have such a problem, do visit us at Midas. Thank you.